client is a 19-year-old female who has a weight of 57.2 kilograms and a height of 157.5 centimeters, which equates to a BMI of 19. Blood pressure was also taken and was within the normal range of 180 over 21 millimeters of mercury. The client undertook multiple pre-screening methods, including ESSA's adult pre-exercise screening tool and the ACSM's pre-screening tool, which aims to identify individuals with a known disease, possibility of a disease, or non-disease related factors which may be a risk during physical activity. The client's results showed no chronic disease-based risk factors, however identified a chronic injury. The PARQ questionnaire identifies any risks that may be symptomatic during exercise, in which the client passed. The Fantastic Lifestyle Checklist is a questionnaire screening tool that is concerned with factors such as exercise, nutrition, personality, and lifestyle, which the client scored very good. The client's medical history did not report any conditions, nor is she currently on any medications that may be a risk during exercise. The client is overcoming a stress fracture in her pelvis, which presents symptoms of severe hamstring pain that causes her to limit physical activity. She has completed her physiotherapy rehabilitation but is still undergoing regular checkups with her physio and sports doctor. She has now been cleared to return to running and greater weight-bearing activities. Exercise was of a high priority for the client before she began experiencing hamstring tightness. She participated in moderate to vigorous physical activity on average 4 or more times per week, which would usually involve gym sessions, running, and touch football. Her gym sessions involved upper and lower body resistance training, as well as strongman circuit training once per week. The client expressed the goal to be able to run half a marathon. However, training for such an event is not reasonable within the 4-week allocated time. With this time restraint in mind, a more realistic goal that was agreed upon was to be able to run 5 kilometers with no hamstring pain. The health-related sub-goal involves improving lower body muscular endurance, as this will assist in running performance. As the client has been focused on upper body strength during her rehabilitation, reductions in lower body muscular strength are to be expected. The improvement in strength will be specific towards muscular endurance, as the ultimate goal is specifically endurance-based, and is also important in the rehabilitation in hamstring strength. The use of appropriate eccentric hamstring activation is important in the rehabilitation, as most hamstring injuries occur during the eccentric phase of running. The second sub-goal is behavioural based and is primarily focused on the client's time management. Being a full-time university student, working part-time, and in 2 internships, time management is a significant variable in the success of the client achieving the ultimate goal of running 5 kilometers. The final sub-goal is exercise specific to help support the goal of running 5 kilometers, which is improving aerobic endurance. As the goal is specifically aerobic, improving the client's aerobic capacity through the exercise that isn't always loading will assist in preventing further pain or re-injury. One of the most significant and perhaps obvious needs to run 5 kilometers is aerobic capacity. Factors that affect endurance include cardiac output and a high rate of oxygen delivered to the muscles. This allows for a high capacity for ATP synthesis and regeneration. Therefore, reaching a high VO2 max is a significant indicator of sustaining the required aerobic capacity. The adaptations in well-trained distance runners allows for greater muscular power, a heightened ability to store and release elastic energy through greater stiffness, and greater neuromuscular control to improve efficiency. The client-specific needs also include ensuring the rehabilitation of a hamstring to make sure it is suitable for endurance running, as fatigue is suggested to be a causative factor for hamstring strains. Therefore, muscular endurance is also important to consider in writing her exercise program. In the needs analysis, relatively good aerobic capacity is required to run 5 kilometers, which is measured by maximum oxygen uptake, or VO2. This will be a test that the client will be recommended to participate in before the program is written in order to investigate current aerobic capacity and therefore identify how much improvement will most likely be necessary. At the end of the program will indicate if the improvements were made. To ensure the client is maintaining efficient time management, strategies that can assist in balancing university work and exercise can be used. They may include sitting down and creating a weekly plan every Sunday night to ensure that the times that are allocated include study and exercise. To measure improvements in lower body muscular strength endurance, a baseline measure needs to be taken. With this in mind, a 1RM test will be conducted for a strength marker. Then 60% of 1RM will be lifted as many times as possible for muscular endurance. She will complete this method for a squat or leg press for quadriceps and a leg curl or deadlift for hamstrings. It is the practitioner's recommendation that the client participate in recommended pre-program testing, take part in a 4-week exercise program that is designed around achieving her ultimate goal, and of course testing the success of this intervention at the end of the 4 weeks.